In this video, we discuss the use of dichloroacetate during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Dichloroacetate, DCA, is an unpatentable compound. It has references in PubMed going back to the 1950s. Commercially, it is used as a caustic agent and even has been used in tattoo removal. DCA is able to reverse mitochondrial dysfunction, a hallmark of cancer in tumor cells. By reactivating these mitochondria, DCA increases apoptosis, as apoptosis is controlled by the mitochondria. DCA also reduces lactate accumulation, which destroys the acidified tumor microenvironment surrounding the tumor tissue. This allows therapeutic agents to reach the tumor tissue more easily. In humans, oral DCA has also been found to decrease lactate dehydrogenase levels, LDH, an independent predictor of unfavorable outcomes in many cancers, and triglycerides, while increasing ketone bodies. It can also penetrate the blood-brain barrier and inhibits VEGF, which fuels angiogenesis. DCA has shown efficacy in numerous cancer lines, including lung carcinoid, breast cancer, neuroblastoma, prostate cancer, multiple myeloma, kidney cancer, melanoma, endometrial cancer, and many more. The only time it had a less than encouraging result was one study for colon cancer, even though the majority of colon cancer studies support DCA's effectiveness. It has also been shown to increase the effectiveness of radiation, decrease the side effects associated with chemotherapy, and prevent cancer from recurring after surgery. The first human trial of DCA was in 5 patients with glioblastoma. 3 of the patients were facing a recurrence. One of the patients began DCA treatment with a very large tumor and brain edema. He passed away 3 months after initiation of DCA treatment. All of the 4 remaining patients were clinically stable at 15 months and alive at 18 months. This is an astonishingly positive result. The patient whose MRI is shown faced recurrent glioblastoma and was refractory to chemotherapy. The initial MRI and PET scans are on the top. The ones on the bottom show a shrinking of a tumor 9 months later after treatment with DCA. Again, he had been progressing on standard of care prior to the addition of DCA. In another study, 23 advanced cancer patients with various malignancies were given DCA and 8 achieved stable disease with mild side effects. Again, these people were given no hope outside of the DCA. In another study of 7 patients with multiple myeloma, 1 patient had a full response and 2 more had a partial response while their previous treatment had plateaued. None of the patients withdrew due to toxicity. Canadian Dr. Akbar Khan says he has treated over 300 late-stage cancer patients with DCA and claims benefits in 60 to 70% of cases. He has written case reports about successes in melanoma, colon cancer, and pancreatic cancer. DCA synergizes strongly with metformin and curcumin. A negative side effect of dichloroacetate is moderate neuropathy. Neuropathy can reportedly be lessened if DCA is administered through IV rather than orally. Supplements to lessen neuropathy include acetyl L-carnitine, alpha-lipoic acid, and benfotiamine, an analog of vitamin B1. DCA is commercially available and can be purchased online easily. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.